everyone. Welcome to PharmAssist Virtual Learning Experience. Before we get started, I'm going to read this disclaimer that you can see on the Zoom or on Facebook Live. The PharmAssist Virtual Learning Experience, brought to you by Mendel's Clinical Pharmacy, is intended only as an educational program for patients. Any clinic-specific information shared by the nurse is the opinion of the nurse and is not intended to replace the recommendations or requests of your healthcare professionals. All medications will be dispensed by Mendel's Clinical Pharmacy according to the prescription as written by the provider. So again, everyone, welcome to the PharmAssist Virtual Learning Experience, an educational program created by Mendel's Clinical Pharmacy to bring you together with outstanding healthcare professionals right from the comfort of your home. PharmAssist takes place every Monday at 7 p.m. Eastern Standard Time. Tonight, we'll be providing a live medication instructional program on 3 fertility products, which are going to be the Gonal-f Vial, Menopur, and Synera, including interactive question and answers throughout the program. Please join us via Zoom or Facebook Live, and we invite you to be a part of the experience, just as if you're sitting across from the table from them at your clinic. Today, we are joined by Karen Hammond. Thank you again for your time and interest this evening, and now I'm going to turn it over to Karen.
Hi, everyone. I hope you've had a great day. Happy Monday. Thanks for joining us tonight for this PharmAssist program. I am a women's health nurse practitioner and the founding partner for a fertility practice in Birmingham, Alabama, that just saw our first patients today. We just opened. It is such an honor to be with y'all tonight. Thank you for tuning in. And I hope you can get some helpful information that will be a great adjunct to what your healthcare provider and your healthcare team has already talked with you about. Maybe expand on a little bit more. This is a judgment-free zone. Any questions that you have are great questions. No worries about asking a silly question or a stupid question. The only ones of those are the ones that you don't ask. Not only do I want to thank y'all, I'd like to thank Morgan and the awesome people at Mendel's for facilitating this program. PharmAssist was set up to help folks to do just what we're doing, and that's reach out to patients just to provide that assistance that you may need, just a little reinforcement and positive feedback for some fertility medications. We do this every Monday night, and each Monday there's a different provider on that will go over a few medications. If you don't hear your medicines discussed tonight, then you're very likely to hear them on another Monday night. Also, even if these aren't medications that have been prescribed for you, it may be helpful just to hear a perspective on injection technique and where to do the injections and mixing. You might find some valuable information. So with that being said, the first medication I'm going to talk to you about tonight is Gonal-f. Gonal-f is follicle stimulating hormone, one of the few hormones in the body that does exactly what it says it's going to do. And it stimulates the follicles or the egg sacs in your ovary to grow and develop and mature eggs. With this medication, it will require that you have some monitoring and careful observation by your healthcare team. This medication can be provided, administered in one of 3 ways, 3 different methods. One is with the Gonal-f pen. Another is with Gonal-f multidose. And the third way is with Gonal-f vials that each have 75 international units. So that's what we're going to talk about tonight. And I'm going to get Morgan to go ahead and start that video, and we'll talk about it a little bit more on the other side and answer any questions you may have. So if you'll start the video. Hi, I'd like to talk with you a little bit about how to give the Gonal-f vial. It will come in a package that has a vial, 2 needles, and a syringe that has the saline to dissolve the powder that's in the vial. You start by just simply opening the package and removing the contents. Next, there's a little cap that covers the tip of the syringe. Just unscrew that to remove. Then you can put the needle directly onto the syringe. Your provider will tell you whether to use an intramuscular or subcutaneous needle. In general, this is given subcutaneously. Next, you'll take the top off of the needle and grab the vial that has the powder, the medication in there. Gently lift off the top of that vial. Put the needle directly into the rubber stopper on the vial and inject all of that liquid into the vial. Each vial has 75 units of Gonal-f in it. If you're prescribed more than that, you may need to use more than one vial. You'll still just need to use one syringe with the liquid. Next, turn the vial upside down and withdraw all the liquid by pulling back on the plunger. After you removed all the liquid, remove the needle from the rubber stopper of the vial, and you're ready to give the injection. Start by just wiping off the area that you selected to do the injection one time. Put the needle straight in after you've bunched up the skin, slowly push in the medicine. Release the skin and pull the needle straight out. If there's a little drop of fluid or some blood on the outside, just simply wipe it with some alcohol and apply a bandage if necessary. Finally, take the syringe with a needle on it and drop it into a sharps container just to prevent any injury from it later on. And now you've given your first Gonal-f vial. Pretty easy medication to do. I have all of my patients take it subcutaneously, which is just in the fatty tissue. It can either be given in the fatty part of the back of your arm or around the area of your belly button, a couple inches away. I usually tell my patients to go an inch or two beneath and beside their belly button. Just pinch up a little bit and put the needle straight in to inject it. You can also give it in the outer part of your thigh if you're more comfortable with that. But I tell you, patients that do it in their belly, really, no patient really has problems with injecting it. But I think that your belly, believe it or not, is one of the easiest places to give injections and to receive injections. I know when I was a kid, my mom told me not to go pet everybody's animals because if I get bitten by one of them and it has rabies, I'll have to get shots in my stomach for a month. And that kind of terrified me about the thought of having to do injections in my belly, but patients that do that are very pleased with it. Nevertheless, pretty much any place you can pinch an inch is a good place to give it. So I'm going to see what questions we have, Morgan.
Okay, awesome. I totally agree with you. I'd say the stomach area is what I recommend most of my patients as well. Especially sometimes us lovely females have a little bit more in that area to kind of pinch up some. So first question is, why would my provider prescribe the vial over the actual pins?
That's a great question. So how do we choose as providers, how do we choose which formulation we think is what's best for you? One of them is just provider preference. It can be the amount of medication that you're taking, or it can be your own personal preference. My opinion about this is we want to give I like to give what's least expensive. So if you need, for example, a certain amount of medication, and you just need just a tiny bit more, you don't need another full 300 units or 450 or 900, then we may be more likely to give you a 75 unit multi-dose. Another reason I may use this medication is for patients who are taking a mixed protocol where you're taking not just FSH like Gonal-f or Follistim, but also taking Menopur that we'll discuss next. The Menopur is mixed exactly like this. So what you can do is draw up 1 cc of liquid and just have all your vials lined up and draw up the liquid, squirt it into a powder, draw that up, squirt it in the next powder, draw that up, squirt it in the next powder. So it's a little assembly line with the same liquid that's there to reconstitute and all of the powders. The good thing I think about the Gonal-f 75 IU vial is that it's just so easy. You've got the liquid there, you just squirt it in the powder and it dissolves instantly. You don't have to shake it or mix it or do anything fancy. It dissolves instantly. So it's really easy to do. And if you just need a little bit more medication, it may save you a few dollars by not buying more than you actually will end up taking.
Perfect. Such a good point. And then what the second question is, what do they do if they see when they're drawing up the Gonal-f, they see some little bit of air bubbles within their syringe?
Great question. You know, everybody worries when you give an injection or receive an injection that it's going to cause instant death if it has a little bit of air bubbles in there. Actually, if you put a needle in to your belly, if you put you don't have to do this, but when you're giving your injections, if you draw back a little bit on the plunger, you'll get a little bit of air in there. Our bodies have lots of air in the tissues. So if you get a little bit of bubbles in there, it's not a problem at all. Only on soap operas is it instant death. But if you want to try to get them out, what you can do is hold it where the needle points up, hold the syringe where the needle points up and just thump it a little bit. And the bubbles all rise to the top. And then you just push on the plunger. Sorry with my use of a pen for demonstration, but just push on the plunger just a little bit and you can watch all the air bubbles go out. Pretty easy to do. But if they're just a couple little tiny bubbles, sometimes there can be bubbles on the side of the syringe that are going to seem impossible to get out. If it's really driving you nuts and you want to make sure you can do it, you can pull back a little bit more on the syringe and put more air in there, then thump it and push it out. And that's more likely to push out the air bubbles. In fact, I like to leave just a little bit of air in the syringe, just back to the first line or two. So it's just a little teeny amount. I like to leave a little bit in there because that way when you give the injection, it kind of seals it in place. Sometimes right after an injection, you can notice, as I said in the video, a little bit of blood or fluid come out right after the injection. If it's fluid, it's a little bit of the medicine. Now, it's not going to make or break your cycle, but again, I'm cost conscious, so I like to make sure that my patients get it all. So I'll actually recommend that you leave just a teeny bit of air in the syringe to kind of seal the medicine in the tissue.
Such a good point. I tell my patients the same thing, even also in drawing up their medication. So if they get nervous and hit the end of the syringe or something, they're not worried about their medication flying out. Second question is, what do you do? Let's say you have a 75 unit vial, but your dose is only 50 units and you have 15 remaining. What do you do with that extra medication? How should you store that vial of Gonal-f?
You know, great question there too. And again, I'm very frugal. The package insert says once it's mixed, then you should use it. This isn't intended to be a multi-dose formulation. So it says you should use it or lose it. In all likelihood, you could probably stick it in the fridge and use it the next day. However, there's just 75 units in there. If you only need 50, then you're going to need to open another one anyway. So I don't think there's a huge amount of valor in trying to keep saving it. If it were me, I probably would. I just put the date on it, stick it in the fridge, and then just in case I need a little bit more after the next 75 units, if that vial had been opened, if I need more out of it than just that.
Okay, perfect. And last question, you did mention that it's usually given sub-Q. Should patients be worried if their provider prescribes it IM or vice versa?
Great question there too. And absolutely not. Don't worry about that at all. If your prescriber has recommended that you take it IM or sub-Q, follow what their recommendations are, because they have your best interest at heart. They know your exact situation and are rooting for you to be pregnant, just like all the rest of us are. So follow what your prescriber says. It is approved to be given IM or sub-Q. That will be based on your provider and what their recommendations for you in particular are.
Okay, beautiful. I don't have any other questions that I see that have come in. If you have anything else to say, now we can, or if not, we can get ready for the second video.
Perfect. Thank you. So I think this is a great formulation of medicine, especially when you need just a little bit more, or if you're taking that mixed protocol and may need to draw repeated vials of powder. You can just draw up that one syringe with the liquid and squirt it in. One thing I will say, if you're taking several bottles of powder, I'm not sure exactly how it happens, but if you draw up several of them, it may look like the volume is a little bit lower, and it will be. It's not going to be any problem at all. That's all taken into account by your providers in the pharmacy and the manufacturers of the medication. But if you notice a little bit less medicine in there than you had thought would be there, no problem at all. And if a little bit drips out of the top of the bottle or of the needle of your belly, that's not going to make or break anything either. So anytime you have questions about it, always reach out to your provider or the folks at Mandel's, and we'll be happy to walk you right through it. I'd like to talk with you about administering Menopur. If your prescriber has recommended that you take Menopur, it's given subcutaneously, which means in the fatty part of your skin. You can either generally give it in your lower abdomen or in your outer thigh. It's quite easy to mix it. It does take a few steps though. You need to start by taking a look at what your dosage is. Each bottle of the powder of Menopur contains 75 international units. So if you have been prescribed 150 units, you will need 2 vials of the powder. No matter how many vials of powder you'll still just use 1 cc of the liquid. So I like to start by opening up the tops from all of the bottles. So we're going to do a demonstration today for 150 units. So you'll need, again, 2 powders, and you just lift the top up of the vial of both powders. It actually just lifts up really easily. And then lift off the top of one of the liquids. The liquids are just a way to dissolve the powder. There's no medication in here. It's important you use this liquid, but don't worry, you'll probably have some liquids left over. The next step is to take a Q cap. You may not have ever seen one of these before, but you just open up the package, and there's a little device that's in here that will just slip right onto the top of the ampule of the vial. So take the vial of liquid and just snap the Q cap right on top, just like that. Next, you'll take a syringe that will be provided with your medications, and it just screws right on top of the Q cap. Then the pretty cool part begins. Just draw back about a cc of liquid. If you get some air in there, that's okay. We'll have plenty of time to get that out. Once you get the liquid into the syringe, take off the syringe and the Q cap as 1 unit, and that has all of the liquid that you'll need. Next, you'll take the first vial of powder, attach the Q cap, squirt in all of the liquid, swirl it around a little bit, but it dissolves very quickly. Turn it upside down and withdraw that mixture. Now you have 75 units in the liquid in the syringe. Then take the Q cap and the syringe off as a single unit again, and put it on to the second powder. And it just snaps right on. Squirt in the liquid, swirl it around a little bit to make sure it's all dissolved, and then draw up that mixture. After that's in there, you have both of the ampules of powder, the vials of powder, in the syringe. Just unscrew it, and you're ready to put a needle on the top of it. And you can just take the tiny little needle right out of the package, and similarly, it'll just screw right on the tip of the syringe. And it's ready to give. When you give this injection, you might first want to take an alcohol pad and just swab the area that you want to give the injection. Then take the needle off, take the cup off the needle, bunch up the tissue, insert the needle straight in all the way, and then just push the medicine in. Release the plunger, wait a couple seconds, pull the needle straight out. If you need to, you can wipe the area with the alcohol prep and apply a bandage if you have a little bit of bleeding. But just like that, you've given your injection of Menopur.
Okay, awesome. Thanks for that. Okay, so the first question that came in is, how does Menopur actually work? Like, what is it mimicking in a woman's natural cycle?
Great question. So I think it's important for you to know what the medication, every single medication that anybody takes, you should know what it's doing and why you've been prescribed that. Menopur is a combination of two hormones that our bodies normally produce. And that is follicle stimulating hormone, similar to what's in Gonal-f and follistim. But it also has another hormone called luteinizing hormone. And both of these hormones are actually needed to help women to ovulate and to grow and develop follicles. So certain women don't make LH. Most women do, but some women don't make LH. And those are women that have a specific ovulatory problem. Hypothalamic hypogonadism is the name of it, where you just don't produce much FSH or, much LH or FSH at all. Another time is when you're taking medications that slow down your own hormone production or maybe even stop it. And those medications are leuprolide acetate, most commonly referred to as Lupron, or some patients that are taking the GRH antagonist, like ganirelix or cetrotide. Your provider will tell you exactly which medicine is best for you. And based on your individual circumstances and your treatment plan, it may be that they feel that the LH is an important hormone for you. And so you don't have to take two different injections. You can just take the Menopur. Now, Menopur is often used as an adjunct when you're taking Gonal-f or follistim if you're doing IVF. So you may be prescribed what we and as your providers will call a combination therapy or combination protocol, mixed protocol. And that simply means that we prescribe one medicine that has just FSH as well as the Menopur that has both those hormones in it. Your provider will help guide you as to exactly what's best for you.
Okay, beautiful. Great explanation. Second question is, someone said that they noticed the Menopur burns a little bit more than like their Gonal-f that they had. Any tips or tricks you could help with that burning sensation that a patient is having?
That is a great question about the discomfort with Menopur. And you are right. Some people say that it's no different from any other medication, but some people do say that it stings a bit. It stings kind of like a mosquito bite. You might feel it and it stings just while you're being bitten. And then as soon as you're done, it stops. I've never had a patient say, oh, this is just miserable and I can't stand to take this medicine and do something else. But you may feel it a little bit. There are a couple of things that I recommend. One is if you use alcohol to wipe off the area, let it dry before you give the injection. I think that it stings less if you do it in your belly than other places. I think the belly injections also tend to bruise a little bit less than other places. After all, we are having you put, even though it's a short little thing, we're having you put a needle in your belly, or into some site, so you may have a little bit of bruising. I think it's a little bit less in the belly. But the next medicine that I'll talk about in a few minutes is called Synera, and you can just put this patch on your belly about 20 minutes or so before you do the injection, and it just kind of numbs the area. We'll talk more about the patch in a little bit, but just know that this may sting a little bit more. The primary reason I think that it does sting a little bit when you give this medication as if this is a human-derived product. It's a little bit more natural product. It's not manufactured in the same way in the lab. And so it's being human-derived, the proteins are a little bit bigger, and that may cause a little bit of stinging. Again, nobody that I've taken care of has said that they don't want to take Menopur ever again because it's so miserable. But talk to your provider. They may have some other ideas as well, and consider giving these ideas a try.
Great. Yeah, I would say even if it might burn a little bit, it's really quick. And again, nothing that patients can't do and get over really quickly. So speaking of Menopur and maybe burning, how long are patients usually on like Menopur? I know very average speaking, everyone's gonna be a little bit differently, but just so patients can kind of prepare how long they may be on the Menopur.
Perfect. Great question. So these medications are generally prescribed based on your individual health history, the purpose of the treatment. So if you're having just to stimulate your follicles to grow a little bit, or if you're doing some form of IVF, but also what your protocol is for that treatment. So sometimes you take just injectable medications. Other times you might take an oral ovarian stimulant like Clomid or Letrozole, and then later add in some of these medications. So if you're doing that, if you're doing a cycle with a combination of an oral medicine and an injectable, you may take these shots for just 3 or 4 days. If you're doing a more aggressive IVF stimulation, or you're doing a more aggressive stimulation for an insemination, where you take just the injections, the average is probably somewhere between 8 and 12 days. I guess that makes that average 10 days, but that's a good ballpark number of 10 days about how long you may take it. Most providers will do some careful monitoring if you're taking this medicine in any form and for any procedure, just because we want to make sure that you don't make too many eggs, or that it's going to put you at risk, or that we want to find out exactly when the time is for you to ovulate. If you're taking these injections, we're going to have you also take a medicine that causes the release of the eggs, or at least the final maturity of the eggs, before we would do an insemination or to take the eggs out for IVF.
Beautiful. Kind of leads into the next question. As you said, your provider is going to be monitoring you closely with these medications. Is it common or should patients be worried if their provider adjusts their medications? I guess same thing for Menopur or Gonal-f for as their treatment goes on, for that value of units that they're on to go up or down.
Gosh, that's so important to ask. And sometimes I forget I forget to tell patients at the very beginning that we may change your doses. Part of the purpose of monitoring is that we want to see how you're responding to the medicine and when we should help you to ovulate with the other injection that I'd mentioned. But also it helps to guide us to have the best stimulation possible for you. So we may go, if your follicles are getting big quickly, or your estrogen's getting really high, then we may back off and decrease your dosage. Commonly with IVF, if you're taking just these medicines, you'll take a certain dosage and then we'll decrease it after you've taken it for 5 or 6 days, maybe even less. And sometimes if your follicles aren't growing as quickly as we'd like, or your estrogen's not going up as well as we'd like, we may bump the dosage up. Or we may say everything looks just right and keep it the same. So it's kind of like the Goldilocks principle. Is it too big, too small, or just right? And we tailor your drugs to match that, and can adjust your dosage as we need to. Great question.
Yeah, I tell my patients, not every patient's the same. So if your friend was on this dosing, does not mean that you're going to be on that dosing, which is always a good thing, because we want to tailor our protocols to our patients individually. Okay, I don't think there's any other questions. If you have any final thoughts on the Menopur, this would be great. And then we'll kind of get the next video rolling.
Great. I just want to remind you that your healthcare professionals are very eager to provide you with custom-made, tailored to you treatment, and they will tell you what medications they feel are best for you and prescribe those accordingly. So keep in mind always that we're here for you as healthcare providers. So feel free to reach out with any questions. No question's a bad question. And you can always reach out to the folks at Mandel's too for some general information, but specific to you information needs to come directly from your healthcare provider.
Yeah, exactly.
So, perfect. So with that being said, I'll move to the next product, and it's the Synera patch. And this is one of the coolest things that that we've been able to offer patients in a while, because it actually kind of numbs up the tissue before you give an injection. These Synera patches were originally developed for children that were having to get blood drawn, or it was actually developed for kids with cancer that had to have repeated blood tests and treatments where they were being stuck a lot. And, you know, we all have nightmares from our childhood when we were being stuck. And sometimes those memories persist and make us afraid of taking injections and going through some of these things. So most patients do just fine without having help from patches, but some patients, they really need these patches, and it's really a benefit. Kind of warms and numbs the site where you're going to do the injection. So if you'd go ahead and cue up the video, we'll take a look at that, and then we'll address some of the other areas about the Synera patch. I'd like to talk to you about applying the Synera patch. This patch may have been prescribed to you, or at least offered to you by your healthcare provider just prior to giving your injections. If you particularly have a fear of needles, or if you're worried about one of the injections hurting, this patch may be a good alternative for you. To do this, you first want to take the patch out of the package just by opening it up. And it looks just like this, kind of like a big bandage. And there's a little opening right here where you can pull the patch off of the outer backing and apply it directly to the area, the sticky side, directly to the area where you're going to give the injection, and it'll just stick to the skin. In most cases, it's for progesterone, and you're just going to apply this directly to your hip. This part right here is medicated, and it will feel warm to the touch, and it numbs the skin down deep so that the injection will be fairly painless. It's important that you apply the patch about 30 minutes before you take the injection. When you're ready for your injection, you simply remove the patch, wipe the area with alcohol, and administer the injection. You may continue to feel a little bit of warmness or a little bit of numbness for up to an hour later. So pretty cool. Who would have ever thought that you can use a little patch like that? The patches actually look like Band-Aids. If you were to fall and skin your knee and you need to put a Band-Aid on it, it kind of looks like that. I took the entire backing off just to show you what it looked like in the video. But you can just peel back part of it to apply it. Now, these applications, the patches, are about $10 a piece. Insurance sometimes covers it and sometimes it doesn't. If it covers it, you know, I'm all about using it. If it doesn't cover it, it's a little bit more of a thought process. Is the discomfort or fear that you might have about the injections, is that $10 worth, or is it not? Some people say it's a lot more than that worth, and they're going to use it no matter what. And other people will say, oh, maybe it's not so bad after all, and I don't need to move ahead and use it. So it's individual preference for you. Is something that if your healthcare provider doesn't recommend it for you, you can always ask about it. And I'm sure they'd be happy to prescribe that for you. It is by prescription only. And what I do for my patients is when I write all of their IVF prescriptions, I will put Synera patch upon request. And you can ask your provider to do that as well. And that way, when the prescription is sent into Mandel's, the folks there can do a prior authorization for your medications and do a little test claim and see if your insurance will cover it. And then they'll reach back out to you and say yes or no, whether or not it covers it and whether or not you want it. I think it can be great, especially for people that have fear of needles anywhere. I even tell my patients that are fearful of needles, they can put it on their arm where they have their favorite vein to have blood drawn in about 20 minutes or so before their appointment to have blood drawn. And that works phenomenally well without compromising drawing your blood. And it's a whole lot easier than even thinking about having an injection of lidocaine, because after all, that's another needle and that does sting. So I think it's great for people that have a fear of needles as well. A couple of important things, since they do cost $10 a piece, a lot of patients will say, "Ooh, I think I'll just cut mine in half." Well, it doesn't quite work that way. It's kind of like trying to cut a Benadryl capsule in half. Once you open it up, it's kind of lost. So don't think you can save by doing that. You can't save on it by just wearing it for 15 minutes and then taking it off and closing it back up. Once it's activated after you've opened it up, it's going to be used up and can't be used again. We tell people to put it on about 20 or 30 minutes before their injection or their blood draw. It doesn't help to keep it on longer or to keep it on less. It'd be okay, I think, if you forget and it's been on there for 30 or 40 minutes as opposed to 20 or 30. You have it on for 30 or 45 minutes, it's not going to be a problem. I wouldn't just walk around with one all day. And when you take it off, you might feel a little bit of warmness, and it may make just a little redness from taking the bandage part off. It doesn't stick real hard like a super heavy duty Band-Aid or anything, but it does have a little adhesive just to keep it in place. Some patients will put it on the site, especially when you take progesterone and oil injections. That's the place that I see patients most appreciative of it. They'll put it on the site, on their hip, and then they'll just pull their britches back up and walk around and do things normally. And when it's time for the injection, 20 or 30 minutes later, then they remove it and give it. You should plan to give the injection or have the blood drawn within a half an hour of applying the patch. That's when the maximum efficiency of the medication works. So I'll stop there and see what questions Morgan has for me.
Okay, great. I think Synera patches are amazing. The best thing since sliced bread. I've actually used one of them before just to try it out, and I didn't feel I tried with a IM injection, didn't feel the injection at all. Because they are kind of pricey, so I think that's a really good point to ask your provider to at least see if they can prescribe it and then see if insurance can cover it, which sometimes it can. And also know that there's sometimes Synera, the website, they have a coupon for like your first box. That could be an option as well. Okay, it looks like a question I have. You kind of touched base on a lot of questions that came in, but one, are there any side effects from using the Synera patch that patients should be worried about?
There really aren't any side effects. Sometimes patients may have a little local reaction to the adhesive, but that's pretty uncommon. Or so there may be a little bit of redness there, or just redness from the warmth of using it. But I've not seen any problems at all. People will either say that they love to use it and it makes a huge difference, or they opt not to spend the $10 a patch.
Perfect. And then for patients, one patient says she's super scared of needles, has a really bad phobia. Could she use a Synera patch and a heating pack? And if so, should she heat before the Synera or heat after?
I don't think you need to do that at all. That's a great question. But the Synera patch does the heating. I would not heat this patch up, just like I wouldn't stick it in the microwave or something like that. Don't even think about doing that. I don't know why I said it out loud. But you don't need a heating pad with this. This will do the trick. It will numb the area. If you want to use a heating pad on something later, I would wait until you regain all the feeling and the numbness is gone. So I think this will completely eliminate the need or even desire to use a heating pad. If you're not going to use the patches, maybe that's okay. But if you're using the patches, you totally don't need it.
No, I completely agree. They really do the trick. So it looks like the last question I have is, if a patient says she only put her patch on, lost track of time and took it off and still maybe wasn't long enough and still have some feeling, can she put the patch back on if it's pretty immediate? And do you think that would work okay?
Nice. If after about 45 minutes, you've kind of missed the window for it being most effective, you could use another patch, but once you think of it, I would go ahead and do it. So once you take it off, you've kind of used it up and you'd have to use another one or not use one at all. Can't reuse these patches. And if you're taking 2 injections, you can't move it from one, say, oh, I'll just use it right here. And then 15 or 20 minutes or 30 minutes, I'll move it to the other place. So the maximum efficiency is a single use, a single site, and 20 to 30 minutes after you apply it.
Perfect. I think you can't say that enough. It's just they're one-time use. I've had patients try to save them and use them again, and they just aren't going to be as efficient. Okay, that's all the questions I have that came in. If you have any last minute comments on any of the medications, the Gonal-f Vial, the Menopur, or Synera, but now's the time. And if not, I'll close this out.
Okay, perfect. Well, I just want to thank you all again for joining us to talk about these medications. As Morgan said earlier, all of these presentations are archived, so you can watch it again on demand, just going to My Mandel's Pharmacy website, and you can take a look at me doing these medications, other medications, and certainly the other providers that are providing this valuable service with Mandel's by sharing their insight and information. So feel free to check that out anytime. You can also watch these little videos like you would, I used to say Jane Fonda workout videos, where you can kind of prepare your medications along with whoever's doing the video, just to make sure you're doing everything right. Also, if you have a friend or a partner that's going through this, or somebody that has questions and is just wanting to understand what you're doing better, you might want to send them to the website or to the Mandel's Facebook page, because that's where you can see all of these videos on demand. So I want to thank you all, and I want to wish you the best of luck with your treatment for awesome success. And I'll turn it back to Morgan to close us out.
Awesome. Thank you again, Karen, for your expertise. You're amazing. All your answers, your questions were just point on. And then want to thank everyone for joining via Zoom or Facebook. Everyone had excellent questions, and we hope that you learned something to help you with your fertility journey and these medications. Just again, like Karen said, remind you that all these videos are available on YouTube, on Facebook, or on mymandelsPharmacy.com/PharmAssist. These videos, we do these live every Monday at 7 p.m. Eastern Standard Time. So if you didn't see your medications on today, definitely come on next week and join us. And again, if you have any friends going through this, please invite and share. We'd love to have them join us next week. I hope everyone has a great night. And again, good luck in your fertility journey. I wish you all the best. Thanks so much. Take care.